Your midwife will be able to give you a schedule of how often and when you'll be seen during your pregnancy. These are your routine antenatal appointments. These can differ between low risk and high risk pregnancies, and in this talk I'm talking about low risk pregnancies mainly. Please bear in mind, however, that it would not be possible to discuss every single thing that happens during each individual routine appointment on a short video like this. This video is intended to give you a brief overview only. The midwife will have that plan of what you'll be offered and what will be done at each different appointment, but there will always be the following key elements. You'll have your blood pressure done. This can be a bit uncomfortable when the blood pressure cuff is being blown up. Checking your blood pressure is an important aspect of your maternity care because the midwife needs to ensure it remains normal, and if it becomes high, then the midwife may need to refer you to the hospital. You'll be asked to bring a sample of urine to these appointments, which can be dipped. This is to ensure that your urine doesn't have any concerning features such as protein or things that suggest you have a urine infection. If your midwife is concerned, they can send a urine sample off and they may do other tests dependent on the result. Usually, after about 16 weeks of pregnancy, you'll be offered for the midwife to listen to your baby's heartbeat with a little handheld Doppler. This will include the midwife feeling your abdomen. Some autistic women and birthing people find their abdomen being palpated in this way can be really uncomfortable, especially if they don't like being touched. If this is the case for you, please do discuss with your midwife how you might mitigate this. From around 24 weeks of pregnancy, your midwife will ask to measure your bump using a tape measure to check that the baby appears to be growing at the expected rate. If there are any concerns about the baby's growth, you might be referred to the hospital for additional growth scans. This measurement may be uncomfortable to some autistic birthing people, again, especially if you don't like being touched. So please do discuss this with your midwife. Towards 20 weeks of pregnancy, your midwife will start to ask you about your baby's movements, and this is a really important aspect of your antenatal care. They'll want to know when you start to feel those movements, and then after that, whether you feel baby is moving in a pattern that you consider to be normal for your baby. For more information about this, I do encourage you to speak to your midwife. And if you're ever concerned in any way about your baby's movements, you should immediately ring the hospital that you're booked to give birth at, and then I will talk about that department and who should ring in a few moments' time. Other things will be offered at various appointments, and these might include being offered various screening tests that are available, such as dating and anomaly scans and screening for Down syndrome. The routine blood tests that you might be offered as well, including testing for your hemoglobin levels, so checking your iron levels in your blood. The midwife will also take different opportunities to talk to you about different things. For example, they might talk to you about your birth plan, they might talk to you about vitamin K for your baby when your baby's been born, and they might want to talk about infant feeding. Please let your midwife know if you prefer information like this to be given in a written format, if you find the verbal information harder to process, or if you want them to signpost you to perhaps to a video that you can watch later on to reaffirm the information they've talked about. Towards the end of your pregnancy, you may be offered a stretch and sweep by your community midwife. We talk about these in a different video. For more information on what is done at each of these appointments, you may wish to do a search for routine antenatal appointments on the NHS website, because there's some good information on there at what happens at each pregnancy appointment and at which points in your pregnancy you'd be expecting to be seen. The routine appointment is also a great opportunity for you to ask any questions to your midwife that you might have. If you're worried at any time, you can ring the hospital you're booked to give birth at for immediate advice rather than waiting for your routine appointment. They are called different things in different areas of the country, but usually it's something like maternity triage, maternity assessment centre, MAC, or something like that. Please do save the number to your phone, and if you've got any worries, any concerns throughout your pregnancy, please do call straight away. So normally the routine appointment is going to be held in a different place. It might be held in your GP surgery, might be held somewhere else where they do routine NHS appointments, such as a community stadium or a children's centre or something like that. If you've got any concerns or difficulties regarding sensory issues, please do discuss them with your midwife. For example, there might be strong smells, bright lighting. All of these things can happen at different kind of clinical settings you might go to. You do have a right to reasonable adjustments to be made to enable you to feel more comfortable at these appointments. So it's why it's important to let your midwife know as soon as possible so that they can make plans to make things easier for you.